Hey y'all, Dr. Alice Hoyt here with Code Anna of the Teal Schoolhouse, and we are fortunate today to have Dr. Jaclyn Bjelac here. Say hello, Jackie.
Hi, thanks so much for having me.
It's my pleasure. So, Jackie comes to us from the Cleveland Clinic. She is a food allergy expert, and she is here to talk to us today about the recent study by Dr. Ruchi Gupta that looks at food allergy in the adult population. So, thanks so much, Dr. Bjelac, for being here.
My pleasure.
So tell us a little bit about this study and why do you find it particularly interesting?
So, it's a very interesting study, first of all, because it focuses on the prevalence of food allergy in adults, which is something that hasn't been very well studied up until this point. So, the authors of this study used a survey model to poll patients from across the country, adult patients, and asked them a number of questions about food allergy.
And looking at the adults and thinking, well, isn't food allergy more of a kid's disease? Like, what's going on there?
So, the authors found a couple of interesting things, one of which is that food allergy can persist through childhood into adulthood. Most children will be adults at some point, and unfortunately, food allergy
That's
looks
the plan.
so. And unfortunately, food allergy, can grow with them. So they found, though not only people grew up with their food allergy, but about half of adults had food allergy that started after the age of 18.
Is that what doctors thought before? Because that's not what I was really thinking.
So while we knew it was possible to develop food allergy later in life, we had no idea that it was happening up to 50% of the time. That's a pretty big number.
And what are some of the big symptoms that those patients were really reporting that made Dr. Gupta and her team think that that this was real food allergy as opposed to an intolerance?
So they use the same symptoms that we talk about in food allergy clinic when we're talking about what does a food allergy reaction look like. Symptoms involving the skin like hives or swelling, stomach upset with vomiting or diarrhea in some cases, of course trouble breathing, wheezing, coughing. All of those things were symptoms that were used by the team to really ensure that patients who were reporting food allergy were having food allergy reactions and not an intolerance or sensitivity, which doesn't present with those symptoms.
And something you and I were talking about before we came on the video feed was that a lot of and you can tell me the number, but so many of the adults who have a food allergy don't have an epinephrine autoinjector. And with Code Anna, one of our biggest objectives is to make sure that any child who has a food allergy does have that life-saving medication. So tell us a little bit about that and how surprising it was.
Yeah, so one of the things that really stuck out to me when I read the article was that although many of the patients reported even having symptoms severe enough that prompted emergency medical attention or a hospital stay, only about 30% of patients had an active epinephrine prescription at the time of the study, so not adequate.
Wow.
No.
Wow.
Not good.
No. No. When I read the study, I was very surprised at the findings because we do primarily think of food allergy as a childhood disease, and while we certainly have patients who have shellfish allergy who are adults. In some areas of the United States, there's the mammal meat allergy that's associated with a tick bite. But really, I don't think anybody was expecting the 10% number at all. So talk a little bit, too, about food intolerances that you see in clinic. I know one of the comments that we make is sometimes we have a rule-out allergy clinic, which is arguably just as important as having allergy clinic to really help get patients the answer they need and also get them the treatment they need, because an EpiPen will do nothing for lactose intolerance and lactate will do nothing for anaphylaxis. So talk a little bit about what you see in clinic.
Yeah, and not just what we see in clinic, but what the authors found. Almost 20% of adults polled in this study reported a food allergy, but only about 10% had symptoms consistent with real food allergy. So we're suspecting that many people who have an intolerance to food or a sensitivity to food that isn't an allergy are perhaps even unnecessarily avoiding foods or living in fear of a potential serious allergic reaction like we see in allergy. So many times patients come to us with symptoms related to eating food, such as stomach upset or maybe some, delayed diarrhea. Many times patients come to us just sort of generally not feeling well and wondering if it's something that they're eating. And we're still learning so much about how what we eat impacts the body. And you certainly can have things like non-celiac gluten intolerance, but I encourage everyone to talk to your doctor about your concerns. And keeping a food journal might be helpful to identify if there's foods that are bothersome to you, and then maybe minimizing your intake of those foods, but that's not a safety concern so much. So that was one of the really striking findings of this study, was half of the people who thought that they had an allergy didn't have an allergy. So you definitely want to talk to your doctor if you have concerns.
Absolutely. Well, thank you, Dr. Bjelac. Is there anything else that you think that our viewers, that they really need to know about this study, or any real take-home message that you have for our folks today?
Yeah, so the biggest take-home message is, I think we touched on the one about get an epinephrine prescription and carry an EpiPen with you if you have a food allergy. But many of the patients involved in this study don't seem to have a good relationship with a physician. Very few of them have a physician diagnosis for their symptoms. So if you have concerns about food allergy, please reach out to your doctor. They can help you figure out if it's an allergy or an intolerance so that you stay safe.
Thank you so much.
It's my pleasure.
Absolutely. Take care.
Thanks for having me.